So first question, can a neighbor using the pool clean the areas as they touch things, or do we have to have assigned cleaning times? Also, how often do the high touch areas have to be cleaned and the bathrooms? So yeah, a lot of tough question here. So yes, you can request a neighbor to clean things before and after they go. And here again, you kind of have to consider what is the usage going to be like at your pool. If you've got a low use pool, you probably could get away with patrons cleaning as they come and go. If you've got a busy pool, you're going to probably want to have a reservation system, and you might want to allow for breaks between those swim times. So I've seen people allowing anywhere from 15 minutes all the way up to an hour between swim times that you can reserve for that sanitation to be done. And that can either be done by the residents or volunteer staff, or it could be done by a third party. But typically, let's see, high touch areas should be at least once a day. Restrooms should be, I believe it says before opening, and then throughout the day as needed based upon your usage. Okay. So next question, will local authorities issue warnings or straight citations? Will the people not distancing get the ticket, or the board as the pool operator? Or so good question. I think, and well, to be truthful, I don't know, but I think that the people themselves may initially get a warning. And what we've heard from most police departments is that they are going to be giving educational warnings. In fact, in the governor's executive order, he encourages the police departments to make the first attempt to educate those who are violating the policy. So probably the first attempt is going to be a warning. And then if it continues, there would be a citation. I'm not sure if that would go to the people who are breaking the rule or to the association. I think if the association does not have any plan in place for operating with physical distancing, then I would say the association could receive the citation. But if it's just the members, maybe it's more likely that the members will get it. Okay. If the restrooms remain open, can showers and drinking fountains be closed? No, they all have to be available. You can encourage people to use the restroom and shower before they come. In fact, I would encourage you to encourage your patrons to do that and to bring their own bottled water, not to use the drinking fountain. But per code, all three of those things have to be open and available in order for your facility to be open. If it's just neighbors cleaning before and after themselves, do we need to have them sign such as volunteers? So if you have a volunteer task force, you might want to make a log book of that. If it's just each neighbor for himself or herself, I think that's going to be a little harder to have a log book for that. Depends on how specific you want to get. If you want to follow like what that one client of ours has done, where they've named each zone, you could have a log under each zone for, you know, the Smiths were here and the Smiths sanitized. That's up to you. You know, somebody obviously would have to check that. But I would ask that question of your attorney for sure. Certainly, the more documentation you have, the better well thought out your plan's going to be, and I think the less likely it would be for somebody to say this association was negligent. If we won't be using lifeguards or attendants, do we still need to complete your questionnaire? So we prefer that all clients fill it out, but it is not required for our maintenance only clients. So that's entirely up to you. But there are some questions in there that really apply to everybody, such as the furniture arrangement or the furniture policy. Even our maintenance only pools will be happy to straighten furniture and put it back where it's supposed to go if it's in the wrong place. And lost and found policy, that sort of stuff applies across the board. So if you're willing to take the time to fill it out as a maintenance only customer, we would appreciate it. For our lifeguarded and staffed customers, we really want you to fill that out so we can update our staff on what to expect. Do you have suggestions for the kind of tape to tape off sections? That's a great question. I think people are using duct tape and painter's tape, and I don't know. If anybody has information on that, I would welcome the feedback. I'm not an expert in that area, but that's what I've heard people are using. If we know we need to add an attendant in order to open, and that wasn't in our contract, do you think you could staff that? That's a maybe. I will say, we're still staffing up all of our lifeguard and attendant positions right now. We've gotten a number of requests to add attendants, and we're going to try to honor those where we can. One thing where our clients can really help is to put the word out there that we are hiring. There's a lot of people that I think are interested in finding work this summer, but not really sure where to apply because there's just not a lot of intermingling. People are not out and about and finding these things out. Can you describe the duties an attendant can perform if we ask you to staff one? So attendant duties include their primary duty is going to be controlling access. So whatever the policy is for max number of people in the pool area, they can enforce that. They can, if you have a reservation system and they have access to it, they can check who's in which reservation zone and ask people to leave if they need to leave. They can help with basic cleaning duties, replacement of furniture, light cleaning, restocking of the restrooms. They could spray disinfectant on furniture between times that people are there. But beyond that, we have to be careful. We have to give them enough time to do their duties at the front gate, and we also want to make sure that we're not putting them in a position where they're not sanitizing anything. They can assist with the efforts, but that's not their primary responsibility. Okay, can associations that are not your customers still buy sanitizer and spray bottles from us? Yes, you can definitely do that. You're welcome to purchase those and pick them up at our office, or we could deliver it, but we'd have to charge a delivery fee for that. Our office is in Sandy Springs if you wanted to do that. Okay, next, do we have a next question? Yeah, okay. Okay, this might be a legal question. If someone contacts the COVID-19 point person and says they were recently diagnosed with COVID and has been to the pool, should the board send notification to the neighborhood? How would we notify individuals who may have come into contact with that person? So that's a great example. Yes, I would say that is a legal question. There should be, and this is why it's important to have a point of contact, and this is why it's important to have a plan, a response plan for that type of situation. So if it's been several days, then you would try to determine exactly when that person was there, and then do some research to figure out who would have been at the pool at the same time or within the same day. You might be able to determine that by either video footage or key fob records, or if you had an attendant, they might have recorded that. But those would be the types of things you could look at to try to know who to notify. As far as notifying the entire community, that's a question for your attorney. Probably yes, I would say. You're going to have to close the pool, and people are going to wonder why it's closed. So I would think that you're going to have to notify them of something. What are others doing regarding outside guests? We are leaning toward restricting no outside guests. That's our recommendation. Most people are saying no guests. That being said, I think each community has to make that decision. If you have a family where, let's say it's a family of 4 and each kid brings a friend with them, it's a party of 6. They're still following social distancing guidelines by not being a party of 10. That's a hard question there. I'd say, consult with your attorney and on that and decide, but it's probably okay. But also, if you're going to have a situation where that is going to take up space from your regular members using the pool, then you might want to consider that. But if you're a low use pool, maybe it's not as big of a deal. Do you suggest changing pool hours open? I think the pool open hours. Some people are looking at doing that. Some people are reducing their hours so that they can have an attendant on site, and certainly that's a possibility. Again, that's kind of one of those questions where it's no one size fits all in these plans. Your association. If you're a 50 home association, that's going to be very different than a 500 home association. What are your thoughts on hiring resident high school or college students to clean versus a service? Certainly you can do that. I would say they should probably fall under community volunteers and should report to the board and should be duly authorized by the board to do those duties. so that the insurance coverage is present. And so you want to make sure that you talk to your insurance agent before you put that plan in place. But certainly, I think that could be a viable option. If we set rules for members to bring their own chairs, and some refuse to bring chairs, how can we address this? Well, I mean, there's no requirement to bring a chair. Certainly, you can show up and sit on your towel on the concrete if you want to. So that's really up to each person's. I think if you make a bring your own policy, then you need to enforce that by locking the furniture there so that people can't just start grabbing that furniture and setting it out, or it's going to become a free-for-all. As of today, must we have a COVID-19 point of contact person? Yes, in order to follow guidance and the Georgia Department of Health guidance and Governor's executive order, you should have a COVID-19 point of contact person for your community. Where can we find the requirements for the COVID-19 contact? That is in the guidance. There is a link to that on the last slide. So when Melissa sends that out, that you'll have that link, but you can also look it up on the Georgia DPH website. So, okay, it says, might be an obvious question, but lifeguards are not required to follow the 6 feet rule, correct? So there are exceptions for lifeguards when performing a rescue or first aid, that it is okay to break that 6 feet barrier, obviously, for, those are life and death reasons. The same applies for when evacuating the facility. If there's an emergency, let's say a tornado or a huge thunderstorm blows up and everybody's got to get out quickly, that 6 feet of physical distancing goes by the wayside during any type of emergency type of situation. Are there any statistics maintained showing total pools, number open, number waiting, number closed due to date? I'm not aware of a statistic. If I had to guess, I know with our pools, less than 10% are open right now. Just to give you an idea of where we stand. I know a lot of clients are waiting till June to open because they want to see what's going to happen when the governor's executive order expires. And if he does not renew those requirements in some form or fashion, that takes a nice burden off of the association to not have to meet that. So a lot of folks are waiting for that. When will the operating form be available online? It is available right now in the form of we send it out in our customer newsletter. So if you're not a customer of ours, I'm trying to think, you could find it on our Facebook page. It is posted, the newsletter is posted on our Facebook page, and the newsletter has a link to that form. Should attendants wear masks and/or gloves? When assisting with cleaning, restocking, should they wear gloves? So yes, absolutely, great question. We do provide PPE to our staff, so they also will have gloves. And if you have an attendant, we are recommending that they wear a mask. Now, if they're sitting at the pool for 2 hours and nobody's coming and they want to take their mask off for a while, I think that's understandable. But while they're doing their duties and interacting with the public, we are recommending that they wear their mask during that time. And certainly when they're cleaning and restocking, we're recommending to all of our lifeguards that they purchase a mask so that they can also use that when necessary. They might need to have a conversation that's closer than 6 feet with the well, hopefully not closer than 6 feet, but if they're concerned about sitting too close to someone, or that somebody has symptoms in their area, that they can be able to wear that mask. But that would be at their discretion. Are there any certification requirements for the COVID-19 point person? Not that I'm aware of. I think just someone that has an understanding of what the plan is, the response plan if a COVID-19 event occurs, and someone who has the discretion to handle that in a professional manner. So basically, it should be an adult, and it should be someone who, perhaps, preferably maybe somebody who has a little bit of legal experience or management experience in handling delicate matters. If the pool is closed between someone because someone had a virus, what will be needed to open again? So the pool will need to close, first of all, for at least 24 hours. That is the CDC guidance, and I believe also in the Georgia DPH guidance, and following the reporting of a COVID-19 issue at the pool, just to allow the surfaces to be less of an issue. And then we would need, or somebody would need to come in and completely sanitize the facility, particularly the areas where the infected individual was sitting or spending time, and then we can reopen. So we're coming up on the end of the hour. I think we've got 5 minutes left. Question: coronavirus cannot be transmitted through the water. Correct. So yes, as long as the water is chlorinated. There's been no evidence to show that the coronavirus, or honestly just about any virus, can transmit through chlorinated water. So that's why it is important that the water be chlorinated, that it's be tested correctly. So really, the biggest issue or the biggest risk of going to a pool this summer is not going to be from the water. It's going to be from the people around you. And if you're too close to them, and if someone's coughing or sneezing, then you're immediately downwind of them. What is the best practice for guests or additional family members that don't live in the community? I think, again, that's a tough one. I think that's going to depend on the community. We're recommending that if you're a busy community, probably need to have a no guest policy during this time. If you're a low usage pool, perhaps guests can be allowed. So I think you have to take that on an individual basis. And I do want to caveat also what I'm saying. Even if the governor's executive order expires and nothing replaces it June 1st, the CDC guidance is still out there. And we will be looked at as pool operators and pool facility owners as irresponsible if we don't continue to make at least some good faith effort to follow that guidance, even though the requirement portions may go away after June 1st. Regarding pools that decide to remain closed, it seems to have been a preferred approach early on. And now it seems that the encouragement is to try by all means to open. Aside from direct legal advice, is there reason to believe that a decision to remain closed would not be seen as a responsible action by the board? So that's probably going to be a question for your attorney. There's a lot of what ifs in there in that question. I think it's a fantastic question, but I'm not really, not being an attorney, I'm not really prepared to answer what the legal risks there are. I think there are potential legal risks that a community, depending on what your bylaws say, and residents could potentially mount a reasonable argument that if the association has the means with which to put together a plan and open safely and yet decides not to open, you could be in a situation where people are getting very upset and requesting refunds of dues, and that's going to put you as board members and property managers in a very uncomfortable spot, and so you may have to justify that decision. So my advice would be, if you're going to keep it closed, make sure you have laid out your reasoning very clearly and gone over that reasoning with your attorney so that you're comfortable that you're making a good sound decision and that you can't be successfully challenged by members of the community wanting the pool to open. So that would be my whoop, did I get muted? I got a message, somebody's muted. No, okay, we're still on. So I think we're wrapping up. I apologize, trying to read the questions. But thank you guys for having me. Thank you for this opportunity. I hope that you guys were able to learn some things. Obviously, as a pool company, we're biased. We want everybody to get out there and enjoy their pools this summer, and we really want people to continue to learn to swim. As a water safety advocate, it saddens me to hear how drowning continues to be a major issue as pools remain closed, and water safety instruction and swim lesson instruction is really critical. So I hope that we can find ways to safely open our pools. And we're here and ready for additional questions after the webinar if you need any.
Thank you, everybody, so much for joining us today. We do appreciate everybody's times and questions. We have a lot of questions that we have not had a chance to get to. Most notably, people have been asking questions related to pool operating reservation systems. So I will send an email out when we go ahead and send out all of this information that does talk about, there's one system that I am aware of that I have been sending out to everybody. I will say I don't believe it's a free service, but it does operate very similarly to like a Reserve My Courts, where it does allow for people to have different sections. So I have been sending that out. It is in the comments, and we will also go ahead and release that information with the recording and the slides. Again, just to remind all of you, you will receive a full version of this recording, plus all of the slides that Craig spoke about today. So thank you everybody for joining us today, and we hope you have a great rest of the week.